This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
Well, 2 out of 3 is not bad. Dave Wilson sitting in for Kyle Wiggs this week. And as the announcer said, we got David Goldberg with us. Good morning, David.
Good morning.
And Dr. Crystal Atkinson. Good morning, Crystal.
Good morning. How are you today?
I'm doing great. Probably a little bit better than I deserve, but I won't complain. And also we have Jeremy Larew with us this morning as well. Good morning, Jeremy.
Good morning. Thank you for having me.
All right, guys, we got a lot to cover, as we usually do, and not a whole lot of time, so we'll jump right in. Guys, let's get an update on COVID-19, the current situation in Monongalia County, and I'm happy to say at least the numbers are indicating things are improving. I've called it an optimistic trend. Do you guys concur?
We definitely concur, and we're really excited about that. Again, cautiously optimistic, as we said last week. We're starting to see and continuing to see the hospitalization numbers go down, not just here at the medical center, but across our system. So we're very thankful for that. Some of which, and Jeremy will get into, as we're seeing positive patients come through, we've got some different treatment options to be able to keep people out of the hospital. So we're very excited about that.
And David, system-wide, we talk about Mon Health and obviously the Morgantown, Montague County area, but across your system, are you seeing some of the same trends over in Preston County and other areas of the state as well?
We are. I'll give you a sense. So this morning, we're sitting with 5 total patients today with COVID in our hospitals. We had an all-time high of 55 when you added up across our system. So we're we're about 10% or so of it. When you look at our staff today, we have 19 of 3,500, so put it in perspective, but 19 quarantined, 15 that are self-monitoring because they think they were exposed or around someone with COVID, and only 5 providers or staff that are out with COVID. Significantly improved from where we were before the holidays.
You know, I'm glad to see the numbers trending in the right direction, but guys, it feels like a no-hitter in baseball, and we're like in the 5th or 6th inning, and I'm like, I don't want to jinx anything, but I'm really happy the numbers are going in the right direction.
Yeah, Dave, I think you're bringing up a good point. You know, the big thing that's positive here in West Virginia, if I want to use the word positive when we're talking about COVID, is the amount of people that are now getting access to getting vaccinated. I think people are hearing, and you're seeing more people consistently wearing their masks, being socially distant. We have kids in and out of school when it's not snowy and icy, and we're starting to see it. The universities are back, and people are managing the reality better today than they did months ago because they understand the ramifications of actions. But the vaccinations will only get better as we get the Johnson & Johnson, which we hope will be approved by the federal government this month. Then we can actually get one dose in an arm faster. That means we can vaccinate and get people with early resistance and stop the contagious spread and get a little bit healthier. But even when that's in your arm, and as I've shared with everybody, I've been vaccinated, I still wear my mask. I still wash my hands. I still socially distant. You can't let that up. And I think that this COVID aspect, like flu season, is going to be an annual thing that we're going to have to continuously be cognizant of as we move forward.
We'll get into a little bit more about vaccination distribution in just a little bit, but I want to bring Jeremy into the conversation because we're hearing more and more about different strains of COVID-19. There's the South American strain, the South African strain, the European, I think there's one in Great Britain, a different strain. Can you help clear up what exactly we're talking about, and have we seen any of that here in West Virginia?
Yeah, definitely. I think the first step is to understand what you're talking about, strains. Strains are also known as variants. This is where the virus is just changing through a process called mutation. Like you said, we currently have scientists looking at this, and there's been over 1,000 different variations to the COVID-19 currently. We're only looking at 3 or 4 as significant players because the way they changed the spike protein. One of those is the UK variant. We found that first in the U.S. in December 2020. We have the South African variant and the Brazilian variant, both of those identified January 2021. Why this is important is because we're trying to race and keep ahead of this with our vaccination, and it's just important that people understand. But to give you a perspective, we're not seeing it in West Virginia. Luckily, any of the variations and variants, we have not seen a single case reported. But with that being said, all of the surrounding states are reporting these variants. There's approximately 1,200 of the British variants reported in the U.S. In total, so not a huge number, but part of that falls to the issue that we're not testing as much as we would like to be on that. That's quite a process. But the variants are starting. The variants are problematic. We knew this would happen. This is a natural progression of any virus. But we're lucky in West Virginia, we don't have a single documented case.
And that goes back to what we just said a couple of minutes ago, the importance of, even if you do have both shots, you've been fully vaccinated, if you have one shot, continue wearing that mask. It still remains important as we continue to work our way through this, doesn't it?
Absolutely, because again, we don't know enough about the virus, and especially with these new variants, where we're headed. Good news is both the Pfizer vaccination and the Moderna vaccination are showing promising results in terms of still providing immunity for these current variations. But these can pop up at any time. Like I mentioned, there's already well over 1,000 variants known, some not as significant players as the three dominant ones that we're talking about because of the virulence. But like you said, continuing to wear your mask and do all the day-to-day standard precautions is an absolute necessity.
And Jeremy, we've heard a lot about antibodies from the beginning, about whether or not you can build up antibodies if you've caught and come through with COVID-19. Can you explain what the antibodies do in the fight with the immune system and what Mon Health is doing with antibodies?
Yeah, absolutely. Antibodies are our own body's blood protein ability to produce basically a weapon against these viruses. What's happened is we now have monoclonal antibodies, which are not new to medicine, by the way, but they're new in the fight on COVID. Monoclonal antibodies are basically human-made antibodies that act as a substitute antibody to restore and enhance or mimic the immune system's ability to attack cells. What we have at our facility here in Morgantown, we're commonly using bamlanivimab, a very specific antibody that was designed by Eli Lilly, and this came into play in November of 2020 when the FDA gave emergency use authorization for this drug. Now, that's important to give the distinction that this is not an FDA-approved product, but because we don't have the data or the trials, and we have preliminary data coming out that is showing some success. So the FDA went ahead with this emergency use authorization. So the U.S. government purchased approximately 1 million doses of this, and we're lucky to have it right here in Morgantown to give to these patients. And we can go through what patients are appropriate and kind of the criteria and that thing. But again, you just think of it as a leg up on your body that hasn't had time to build its natural antibodies. This is an injection, an infusion of these man-made antibodies for people.
And that's available right here. And to me, we talk about this all the time. Folks think, oh, well, I've got to go to Cleveland, I got to go to Baltimore, I've got to go to Columbus or something to get these treatments. These are available right here in our own backyard, and that is both a blessing and I think amazing.
I agree with you. Yes, this infusion, we've been giving it kind of started up in December. We've started with this. We've had some really good success stories. In fact, out of all the different therapies from the infectious disease standpoint that we're using, I would dare to say that this is the one that we've seen probably the most promise with, honestly.
Before we take our break here, Crystal, if you think you have COVID-19, bears repeating, what should someone do if they're showing symptoms, think they've been in close contact with somebody who has had a positive case? What are the guidelines as of today?
Yeah, we just want to make sure that people are calling their primary care physicians to make sure that they're getting the right information. Certainly, if people feel like they're having any life-threatening symptoms, chest pain, shortness of breath, etc., we want to make sure that they get directly to the emergency departments. Any of our facilities, we can make sure that we treat you.
All right, coming up, we're going to take a quick break, and then we're going to talk about vaccine distribution. We'll discuss herd immunity. I bet you've heard that phrase a time or two in the last year or so. We'll get details, plus, again, an update on vaccine distribution. Monongalia County, the numbers, at least some of the numbers I've seen have been just, again, I don't want to jinx it. Our guests this morning, of course, David Goldberg, Crystal Atkinson, Jeremy Larew joining us. You are listening to Mon Health Live right here on the Voice of Morgantown, 104.5 FM and AM 1440 WAJR.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
And Dave Wilson sitting in for Kyle Wiggs. Also joining us this morning is Jeremy Larew. Mentioned before the break, we jump into vaccine distribution. West Virginia continuing to be at the top of the charts nationwide as far as the rate of the vaccine distribution, and Monongalia County not doing too bad either. David and Crystal, it was just a few weeks ago we were celebrating there were several hundred vaccinations done in one day in Monongalia County. Well, we've far surpassed that now, especially since the Super Hub has opened up as well. How is the vaccine distribution going?
I think it's going extremely well. Lots of kudos from people about how easy it is to get registered. I think the biggest issue I hope that people listening hear is when you register to vaccinate.wv.gov, you'll get a call and a message. But some people don't know it's a call from the Super Hub, as you called it, Super Dave. So the big issue there is we have to make sure they don't think it's just a spam call and to answer their phone. That being said, this week alone, we had days that we were vaccinating more than 1,000 in a day, and on Friday, even multi-thousand. It's all contingent on how much vaccine we get, whether it be the Pfizer or the Moderna. But we're doing extremely well. ICE doesn't help. A federal holiday and a Monday doesn't help, so it pushed everything back by a day.
And you mentioned that waiting on that Johnson & Johnson, and that is key because Monongalia County in particular is ready to do many more vaccines a day. The entire state of West Virginia is ready. We just need to get those doses available, don't we?
Yeah, and I think you probably saw last week the announcement came that the governor signed an agreement with some of our pharmacies, so rural parts of the state, whether it be a Walgreens, whether it be a Rite Aid, whether it be a CVS, are getting some of those syringes so they can help registering onto the website to be able to get people who meet criteria to get those needles in their arms. The other thing, to follow up on what Jeremy said a couple minutes ago, to give you a sense on the antibody treatment that we do, we've done about 100 and counting of those treatments between Preston Memorial Hospital in Kingwood and here at Mon Health Medical Center in Morgantown. And then people from Grafton through Grafton City, they will have the ability in the future, but they send them to Morgantown because we operate our clinic 3 days a week.
We have talked about herd immunity. I think day 2, that phrase came up, herd immunity. And what is herd immunity? Go ahead and explain that. And what would that entail as far as our local region here goes?
Basically, I think the easiest way to understand that is when you have a large proportion of the community, and that's where they get the term herd, becomes immune to the disease, whatever that may be. So basically, I'll try to put it into perspective for you. We're in the United States, we're up to receiving about 1.7 million vaccinations every day. It would take us about 8 months to get 75% of our entire population 2 doses. We would hope we had herd immunity sometime in that time frame. So we'd be looking at late summer if everything goes according to plan with these current projections and where we stand today. In West Virginia, we have 8% of our population fully vaccinated, and we have 14% of the population has received at least 1 dose so far. So we're likely ahead. We're definitely ahead of the curve nationwide. So we may even hit that much sooner here locally. But again, it's kind of looking at the larger population. That's why I wanted to mention on the larger scale.
It's a good place to be here in West Virginia, no doubt about it.
Absolutely.
What about for someone who may have tested positive and had COVID-19? Do they have an immunity, or do they have antibodies that are built up that could help fight the virus in the future? What is their status?
So, as we get more data and we get further out from the onset of this pandemic, we're learning more. We used to think we had at least 90 days of immunity, and we now know a lot more than that. The 90 days came from we had people 90 days out that were still doing well. So the latest and greatest is that 95% of people who recovered from COVID-19 had durable memory of the virus up to 8 months. And again, that's kind of where we're at now, the 8-month mark to go back and get data. So it's very promising that these patients are showing long-term memory to fight off the virus with the antibody. But how long, like David mentioned earlier in the segment, this may be something we deal with cyclically on an annual basis. We may need boosters. It's a little hard to predict at the moment, but stay tuned. Time will tell.
Yeah, every day we learn a little bit more and a little bit more, and Crystal, that just helps this battle of getting over the hump here, and that light at the end of the tunnel every day just gets a little bit brighter.
Yeah, absolutely. And we continue to make sure that, as we've said before, continuing to do what we have been doing in the past. Let's make sure that we're socially distancing, we're wearing our mask, etc. I know it's tiring, but we will get there if we all are doing the same thing, processes.
We are all looking forward to the day we can leave that mask at home for a little bit. For folks who are sitting there and they think, hey, something's bothering me, and maybe I should go get it checked out at the doctor's office, or I need to go to the ER. It is important to reiterate over and over, do not put that off. In fact, don't worry about COVID. It is safe to go to a doctor's office, the clinic, or the emergency room. Don't put off your health because of the pandemic.
Yeah, so let me add to that. And I've had the pleasure of meeting so many people in my almost 3 years being back here in Morgantown, and we hear the same question. First of all, when you're not feeling well, make your doctor's appointment. We can visit with you by telemedicine and or in person. If you are COVID positive or suffering with COVID, we have made preparations to help get you into an office or get you into the hospital. Here at Mon Health Medical Center, we have a completely separate area in the emergency room for those with COVID symptoms and or COVID to be segregated away from the general population. So we are prepared. We screen all of our patients before they come into the building. We allow one consistent visitor with all of our patients, whether in the clinic or in the hospital. And you see that. So we've done it. We ask the community, do your part. If you aren't feeling well, call your doctor. If you have COVID and you're coming in the emergency room, call ahead, and we'll be prepared to help you. But don't put off your health care and get sicker than you already are.
And what if I'm looking for a primary care physician? Maybe the pandemic kind of spurred something. Maybe I should just get checked out because I haven't been to the doctor since I got a sports physical in high school. Not naming anybody that I know. Can you guys help me out?
Yeah, go to our website, monhealth.com. You have the opportunity to come in and help us. You can make a phone call in, and we can make an appointment for you. Our offices, like our Wedgwood Primary Care, have walk-in as well, that you could come in and call ahead and be seen and then get you into a consistent primary care provider. I think, Dave, you're making a great point. Many people have put off healthcare for a long time. And what I would say is the primary care home is the base of everything. Just because you have an ache and a pain doesn't mean you immediately go to an orthopedist or you go to a neurosurgeon. Let your primary care doctor help navigate you through the system. It might have been you needed aspirin. It might be you need a medicine. It might be you need physical therapy. But they can help you along the way, and we're here to help you.
Jeremy, before we go, I want to bring you back in. As folks try to wade through the mountains of information that comes out every day, and there are strains and antibodies and herd immunity, what is it that people need to take away from today's program and keep in mind as we, again, continue to work our way toward that light at the end of the tunnel?
I think highlighting again the basics. You can never overemphasize the importance of hand washing, social distancing, and wearing the mask. Beyond that, say you do unfortunately develop symptoms or a loved one has an issue, you want to start thinking of the symptoms as mild or severe. If you have mild symptoms, getting the test, knowing whether you're positive or negative, and if you're positive, quarantining. The antibody comes in and has been proven most effective in patients who take it early and take it when they have mild disease. So that's something to remember with the antibodies specifically. More importantly, if symptoms are worsening, trouble breathing, chest pain, altered mental status with confusion, change in color with the lips or face, things like that, they need immediate attention, and that's where the emergency room comes in. Otherwise, flooding the emergency room isn't the right option. You know, David mentioned we have primary care, we have infectious disease, we have all these other channels, and if we utilize the system properly, we will together get through this.
And guys, the other big takeaway may be just as simple as answer your phone. You probably won't regret it. Right. I know I'm in that habit. Oh, that's spam. Oh, I don't know that number. I'm not going to answer it. But answer your phone. It may be a pretty good call.
Yeah, agreed.
David Goldberg, Crystal Atkinson, Jeremy Larew. Guys, thank you so much for spending some time with us on a Saturday morning. And I can't wait to get you guys back in studio one day. I'm looking forward to it.
We can't wait either, and we'll be masked.
Absolutely.
So much, Dave.
Absolutely. Crystal Atkinson, David Goldberg, Jeremy Larew. Guys, I appreciate it. And as always, to stay informed and stay safe, you can always visit the Mon Health Facebook page. They have all the information there. And, of course, over at the website, you can go to monhealth.com. Kyle should be back next week after his little time off. For all of our guests this morning, thank you very much for listening to Mon Health Live here on the Voice of Morgantown, 104.5 FM and AM 1440 WAJR.